How do telehealth laws affect remote-controlled prescriptions? Imagine needing medication for a health condition but living hours away from the nearest doctor. Telehealth makes that possible, but laws around controlled substances add some important rules. Let's explore how these laws shape remote prescribing of medications like opioids or stimulants. Controlled substances are drugs classified from Schedule 1 to Schedule 5 based on their potential for abuse. Schedule 1 drugs have the highest risk and no accepted medical use, while Schedule 5 drugs have the lowest risk. When it comes to prescribing these drugs remotely, the rules get a bit more detailed. Healthcare providers must first get a special registration from the Drug Enforcement Administration, or DEA, to prescribe controlled substances without seeing the patient in person. This registration is different from their usual DEA registration and involves an application process with fees. The type of registration depends on the drug schedule and the provider's specialty. For Schedule 3 to Schedule 5 drugs, providers can prescribe via telehealth, including over the phone, but only after reviewing the patient's prescription drug monitoring program, or PDMP, which tracks controlled substance prescriptions in the state. For Schedule 2 drugs, which are higher risk, the rules are stricter. Prescribers need an advanced telemedicine registration, and they can only prescribe these drugs in specific cases, such as for pain or attention deficit hyperactivity disorder, with certain documentation. Before issuing a prescription, providers must verify the patient's identity and check the PDMP to prevent misuse. Telemedicine platforms also need to register with the DEA if they connect patients with providers for controlled substance prescriptions. This helps ensure accountability and safety. Some exceptions exist, like for Veterans Affairs patients, where doctors can continue prescribing based on previous in-person visits without extra registration. When setting up telehealth appointments, providers must confirm their registration status, verify the patient's eligibility, and follow all federal and state laws. These laws aim to balance giving patients access to necessary medications with preventing abuse. They allow for continued treatment for conditions like opioid use disorder or attention deficit hyperactivity disorder, especially in rural or underserved areas. However, restrictions on prescribing Schedule 2 drugs remotely can limit access for some patients, especially where providers do not have the advanced registrations needed. The administrative process of obtaining special registrations and conducting PDMP checks can add some complexity for providers and telehealth platforms. Overall, telehealth laws influence remote-controlled prescriptions by requiring special registrations, mandatory checks like PDMP reviews, and limits on certain drug schedules. These rules help keep telemedicine safe while allowing patients to access vital medications from the comfort of their homes.